Помина една година од страшниот напад кој го изврши Хамас врз Израел, кога киднапираше стотици израелски граѓани. Светот го одбележа овој ден со маршови и демонстрации, а Израел, Хамас и Хезболах го одбележаа денот со бомби упатени еден кон друг. Војната се разгорува, освен во појасот Газа, жестоки војни се водат и во Либана, експлозии има и во Јемен и Сирија. Јас сум Кристина Атовска, добре дојдовте во уште еден Лабиринт. По најавата свативте дека се селиме во Бейрут и овој разговор го водиме од либанската престолнина која деновиве е под силен напад од страна на израелските сили. Од Бейрут разговарам со Марина Ел Khawand, основач и председател на едно здружение кое се залака за еднаков пристап и бесплатен пристап до медицинска помош во Бейрут, во Либан, но ова организација или ова здружение веќе е прераснато во интернационално здружение. Мојата соговорничка Марина Ел Khawand е големо наградувана хуманитарка, доби неколку награди за предизвиканите промени во здравството во Либан и има учествувано, односно говорено на Forbes на станите 30 под 30 и е веќе признаена како еден двигател на промените во Бейрут. Моја огромна чест е што разговарам со една ваква личност која навистина прави позитивни промени во низиното општество. Се селиме во Бейрут. Marina El Khawand, thank you very much for accepting this interview. These past few days, your country and your city were under strong attacks of Israeli army. We can see on the international media every night there are rockets flying to Beirut and to southern Lebanon. So first of all, I would like to ask you what is the current situation? What is going on in Beirut, and do you feel safe at the moment?
Hello, Christina. Thank you for tackling the war happening in Lebanon. Well, we all know that the international media outlets are not really tackling it in an objective way, if we can say it. Currently, I'm based in Beirut, which is the region that is getting bombed every single day more than once. And it's getting heavily bombed every single night. More and more. The types of bombs used are some banned globally and internationally. In some cases, they're using uranium. So you can just imagine the sounds, the effects, and the massive outcome of these airstrikes that are targeting the Dahya region specifically, and all the regions on the borders of Dahya. Which is a region in Beirut and the southern of Beirut. And of course, our south, unfortunately, is getting bombed every single day since the start of this war. But the type of airstrikes are getting heavier and much more intense as the days are passing. And also the whole regions of Lebanon are now not safe. As you are asking me if I'm safe now. None of the regions in Lebanon is safe because you cannot know at what time they're gonna bomb next to you or in the region next to your region or the building next to you. Nowhere is safe. What we are trying to do is to take the precautions that you can take, and whenever they give an alert, because they're giving alerts to people living in some buildings to evacuate directly, and these alerts are being done and are being said at late night. So imagine people evacuating and fleeing their homes at 12 midnight, at 1 midnight, and not having any place to go, any shelter to go. All over this war, we have around 2,000 individuals actually that died. We have more than 1 million individuals that are displaced now all over the country. People in hundreds and thousands are now living in schools as in shelters for them. People are trying to find homes to rent so they can stay in a place, in a shelter. People are finding any shelter that they can see, and even they are staying on the streets of Beirut and other regions and the mountains, seeking them as shelter. So it's really very intense, very tough, very hard on all levels, as we can say. If people are not dying because of the strikes, they're dying because of lack of their essential needs inside the country, and the country is in a total state of war.
What about the shelters for the alerts? Are there a lot of, I mean, enough space for the people to go underground, below the ground when the alarms start?
Now, in Lebanon, we don't have a right infrastructure for this. What is underground and what we know that could be like the safe underground shelter is not safe anymore, because the airstrike is getting deeper, deeper, deeper beyond even the underground thing. So the underground shelter is not a shelter for these people. They are seeking shelters that are far away from the regions, the targeted regions, if I would say, the publicly targeted regions. And they are going to schools, to public schools, as the government opened all public schools in most of the regions to accept and to welcome the displaced people from all over Lebanon. But none of these places can really understand the amount, which is a quarter of the Lebanese people. You know, a quarter is now displaced from the southern to the Bekaa region to Beirut. So you have more than 1 million individual who is now displaced across Lebanon. So they are trying to go at any place they can see, and even public gardens are now open for these people. Example, the sea. We have the sea borders in which you can sleep on the borders of the sea, and we've seen that in Beirut many sceneries are just heartbreaking, seeing families just having a small mattress and a small blanket, and they're sleeping on the streets, just seeking for some safe space.
And they feel safer sleeping on the beach than anywhere in the buildings?
Yeah, because they are targeting the buildings. Because they say that whenever they're bombing or striking a place, that this place or underneath this place there is some weapons and some military stuff for Hezbollah, and that's why they're bombing this place. So no building is safe in these regions because you don't know what is underneath you and if it's correct or wrong. So the only safe place for them is public places that are not targeted, and it's not a building, there's no underneath it, and schools, because they're public schools in regions far away from the region that is being alarmed, or they're getting alarms to evacuate it.
You mentioned that there is 1 million displaced people so far. I mean, we see the fights are getting bigger and bigger every day, and this war actually is getting bigger and bigger every day. So, is there enough food, water, medications for these people who are forced to leave their homes and who are going from one place to another? What about the humanitarian situation with these people?
You know, Christina, when you talk about a quantity that is enough for how long? Enough for who? And for how much? This number of 1 million is increasing every single day. And how can we assess the demand and the supply that we have if most of the shipments to Lebanon are getting cancelled, or they are getting delayed? There's no national plan how to distribute, where to distribute. There's no specific statistics that are very accurate regarding this. So if I want to say currently, it's all individual efforts, organizational efforts, and some national efforts from the government or from the ministries that are trying to tackle the situation and are trying to cover the needs, the needs based on the assessments happening inside the shelters. But the people who flew to other shelters that are not public schools and are not assessed or monitored by the government or by organizations, that are now inside any home they found or any place they found, who is covering this need? Who is covering the food, the clean water, medications, and everything? And if I want to talk about my specialty with medications, it's terrible. It's terrible. We're getting demand by thousands of individuals that are in need of chronic medications, except for the viruses that are emerging now. We are heading into a total healthcare crisis, health emergency. There is a lot of cases of COVID-19 just increasing, cold and flu, some also diarrhea and gastrointestinal infections and diseases are being spread directly. Lice is being also spread among us children because people living in schools doesn't have access to proper, shower or bathroom to be able to get the proper hygiene they need. And it's been for 2 weeks. What if we stay for a month, for 2, for 3? What will the situation look like? So, and also we have cases of scabies. So it's just so intense on all levels. If we are now covering the need of this month, who will cover the need of next month and the month afterward? Because as it seems, it's a long-term thing. And if the war stopped now, where will these individuals go? Their buildings, their homes are bombed. They have nothing left. So they're gonna stay in these shelters. They're gonna stay living under these conditions up until, let's say, a period of 6 months, 1 year, 2 years. We don't know. We need a national plan for this. No one is able to grasp and to understand this big amount of directly displaced people without a plan, a crisis plan, how to respond for the need and how to tackle the need and how to equally distribute the donations that the country is receiving, that the NGOs are receiving, and the individuals are receiving. So now in Lebanon, if I would say, Christina, every individual in Lebanon is gathering donations to help one another. It's the individual efforts and the small organizational efforts that are counting on the fields, because otherwise people would have been in dire conditions. People would have died because of famine, malnutrition, lack of medications, and lack of shelter. So that's the situation in brief.
Marina, you mentioned that the country has no national plan. What is the government doing? Are they doing anything at all in sense of organized evacuating of the people after the warnings that Israeli army sends, or delivering food, and of course, what is the most important, as you mentioned, medical care and medications and every other medical needs of the displaced people?
Okay, so to tell you something, Christina, whenever the evacuation alert is being sent to Lebanon, it's being sent over X platform by the Israeli army, and we are receiving it over the news channels inside Lebanon that people living in this region, in this building, should evacuate 500 meters across or on the borders of this building to be able to be safe. But they're giving not more than 10 minutes, 20 minutes for this evacuation to happen. And no one dares to go down the region when the alert is being made, because you don't know how much time you have to evacuate. So people are just taking whatever they have in front of them and evacuating their building. So regarding this plan, if we had a plan, actually, we wouldn't be facing now this crisis on the field, because I would say the government could have imagined that we're facing and we're entering into an official war since October last year, because Lebanon has been defending and has been, many airstrikes have been sent from Lebanon to Israel, and Lebanon was actually Hezbollah was literally in a state of war from the southern borders since then. So we were kind of expecting that we are not, this situation is not gonna end on peaceful terms or on good terms, if I would say, and war is gonna happen, and a larger scale of war. And we've talked a lot about this war escalating to Beirut and to other regions. So why didn't anyone did a national plan for this? why the ministries, the government didn't do a national plan and had the emergency plan, as we say it in Arabic, خطة طوارئ, for these individuals, how to flee them, where to place them, how to give them the support they need for 6 months or 7 months or 1 year even, and how to do so. So we lack this, and this we saw this since October, since August 4, since the explosion. We didn't have any plan, and we're kind of sadly saying this. We're used to the unorganization of this government, and the lack of proper planning and proper respond to the crisis. If I would be also fair regarding my talk, the Ministry of Public Health and some ministries are doing what they can do with the resources they have now. They are distributing in some schools, they are sending aid to some shelters, but again, this doesn't cover the need. This doesn't cover the full need. So how are we planning to cover the full need of these individuals? And even our work as donations on the ground, it's maybe covering 5-10% of the need, if I would say. No one can cover 100% of the need, because you don't know where are these people and how they distribute themselves and how they are managing and how they are coping. And it's really hard. And even some people who are dead, their bodies cannot still be found because of the mass airstrikes. So we're living in a chaotic times now, and in war times, and the regions that are getting bombed and airstrike, no one dares to get inside them because you're at risk, and even the government. And the airstrikes are not keeping anyone safe. Even they are targeting healthcare professionals and doctors, nurses, Red Cross, civil defense members. So whenever you know that no matter who you are, you're targeted, even you have affiliation or you're not affiliated, you're just a normal civilian, you're targeted. So this makes it even harder for you to go on to these regions, help evacuating, help giving support and everything.
So when we talk about the evacuation, are there any safe routes or designated safe routes?
Yeah, kind of. We have up until now. We have some roads that you shouldn't take because they're targeted roads, same as for regions. But again, I would say we never know. We are sleeping and waking up the second day, a new region is targeted. So today it's safe, tomorrow it might not be anymore.
Marina, what about the situation in hospitals? Are all the hospitals functioning? Do they have good supplies in order to help everyone in need?
As per today, a report from the Syndicate of Hospitals and Doctors in Lebanon said that 4 hospitals up until now are out of charge, and this is because of the airstrikes that led to this. Two are functioning partially. The others are fully functioning all over Lebanon, which is the good news for now, because we need hospitals to be and to stay functioning, because all these emergency first aid, Red Cross cases that are being transferred to the hospitals are only tackled inside surgery rooms and treatment rooms, ERs and everything. And beside this, we have normal patients, cancer patients, kidney dialysis. So we have war, we have displaced people, but we also have chronic patients who are already getting the treatments needed and are in need of this special treatment. Regarding the supply, I don't have exact numbers, but as last week, the supply inside hospitals and inside pharmacies could last for 4 months. How can this change? How can this endure? Are we having delays? Yes, we are having, as per our knowledge, because we're commanding and we're ordering medications every single day from local pharmacies and from pharma companies. We are getting a notice, and they are informing us that they are having delays in the shipments due to the canceled flights and insurance things with companies, international companies. So when will this actually be more intense? We don't know. We hope not. We hope that the supply can still be functional for 4 months, and the government hopefully is working on getting further medical aid from countries, example UAE, Qatar, Iraq, and several other countries that are sending direct aid to Lebanon. I hope that the government will use them in a equitable way, and directly on field, and to have specialized teams to be distributing these medications, medical aids, and food donations, and shelter donations, blankets, and everything to the shelters in need, and not having these donations, vanish.
So can they access easily Lebanon nowadays? Because in the past few days, I mean, in the past days and the past year, basically, we saw, for example, Houthis aiming at ships with humanitarian aid. And when it comes to Beirut, in the last few days, I saw that there is a dangerously close strikes to the Beirut airport. So what is the situation with the airport? Are the flights still ongoing? And how do people react when they see the closeness of this attack to the main airport in Beirut?
Yeah. So, Christina, all airlines canceled and suspended their flights to and from Beirut, except the Middle East airlines, which are the national airlines of Lebanon. They're doing an amazing job, still functioning no matter all the circumstances and the odds they face. So, Middle East airlines are the only ones functioning to and from Lebanon. Well, eventually people are not coming to Lebanon anymore, except for emergencies, except that they're Lebanese, and except they're journalists or doctors or healthcare professionals, that they must be in Lebanon, and they're kind of forced to be in Lebanon. So they are the ones traveling to Lebanon. For the ones traveling from Lebanon, massive numbers. Hundreds of people are traveling every single day from Lebanon, evacuating to other countries. Some do have other citizenships, and some just evacuating to a safer place from the Middle East, or from or to Europe, or to the States, or to Canada, and some are just immigrating to other countries. And regarding the official flights the countries are sending, many countries are evacuating their own citizens inside Lebanon under special private planes. So this is happening also from the States. They did it, China, UK, Canada. So all these countries are sending private planes to evacuate their own citizens from inside Lebanon, because their lives are at risk. Regarding the bombs, for now, the airport is not targeted. They said that they're gonna bomb it if an Iranian plane lands in Beirut, but the minister directly stopped this plane from landing. So whenever there is a threat to the airport, the government is trying to tackle this threat and not to place the airport under risk. But the road to the airport was targeted 2 days ago. It was literally so tough and horrible and terrifying times for the individuals. When imagine you landing in a country and seeing the airstrikes hitting Beirut, and you're in the sky. So the lives of the pilots, passengers, everyone is at risk, and even the hostesses and the airline itself. So, but still, they're heroes, because they're still proceeding by connecting Lebanon to the world, by connecting these people to the world. And even with the aid is getting shipped to Lebanon by special airlines and airplanes from the country to Lebanon. So it's not like any airline can send and can ship aid to Lebanon. It's specialized aid from the government and from the country itself, under the patronage of these governments and of these presidents of the states to Lebanon. So it's not like something to be threatened. It's an official aid, humanitarian support to Lebanon that should be, secured at any cost.
And before we go to your organization, because I have to mention it, I am interested in one more thing, because I would like to clarify to the citizens. Do you know, as Beirut citizens, in which areas Hezbollah operates? So do you have those areas that are, for example, dangerous to go, or you have no idea? And because Hezbollah is one of the parties that are inside the parliament, they have 13 MPs, if I'm not wrong. What is the public opinion about this, and what is the connection with the government? So is the government supporting Hezbollah actions, or not at all? And the people as well?
I will not talk and a political background. I'm not a political expert, but I will talk as a Lebanese point of view. The Hezbollah is part of the government. It's correct, and part of the parliament as well. So eventually in Lebanon, they count Hezbollah as part of the official government. And that's why the actions of Hezbollah reflects the state of Lebanon. Because when Hezbollah bombs Israel or launches missiles or airstrikes from Lebanon, it's taken from any country, no matter which country it is, that the Lebanese government accepts this. But this is not a situation, you know? Hezbollah, as an international basis, it's known that it's a militia group and terrorist group, and that's why we have sanctions on Hezbollah members and on Lebanon. Lebanon is now placed on the gray list, economic crisis, and so on. So if I would say regarding this, I will not go further deep inside this. It's such a political matter for Lebanese and in general. There is a part of the Lebanese people and a part of religion in Lebanon that supports Hezbollah, and this is because Hezbollah defended in 2006 Lebanon and led to the victory of Lebanon on the borders and everything. So they truly believe in the efforts of Hezbollah inside the country. But there is also a big majority of Lebanese that, you know, why to drive us into this war? What are we able to get Gaza the freedom they need from this war? We just led Lebanon into a total war that we're not prepared for and we didn't ask for. And we couldn't and we can't even understand the results of this war. Just because we want to defend a country by launching missiles from Lebanon, it's not the way that we can defend it. It's not a way that we free another country by driving a country into a second war. You know, that's my personal opinion. If I would say, genuinely, and just as a human being, not even a Lebanese. If I were in any country and part of what we call a government led us to a war, then I would be definitely saying why. You know, we could have stopped this since long time ago. We could have, defended Lebanon in several ways that we didn't drove ourselves into this war. Regarding the regions where Hezbollah operates, it's basically in the south of Lebanon. It's basically in Beirut and Dahye, Burj al-Barajne. All these areas, eventually, if you now see all the alerts that the Israeli army gave to Lebanese people to evacuate directly, they are the regions where Hezbollah operates. And they are the regions where Hezbollah has manufacturers of weapons underground, as they say, or storage of weapons underground. So these are the regions, as we know, because we don't know more than this, as we know that they are they are under the operation of Hezbollah.
Marina, I already announced you as a huge change maker in Lebanon, and of course you're awarded Humanitarian Woman of Influence because of your work. I'm so honored to have the opportunity to talk to you, and what is most important is that you made these huge changes with your organization, Medon Nations, who now is basically an international NGO. It's not just in Lebanon, but is for helping people in Lebanon. So you already helped more than 20,000 people. So first of all, what about the inspiration to do this? How do you find the strength to do this, and the help? How can you help more than 20,000 people get proper and free healthcare?
You know, Christina, I started my donations right after the explosion. It was because of the needs of the people and because of the story that happened with me. When I met an old lady inside the Karantina region inside Lebanon, which is one of the most poorest regions inside the country, it was the severely affected region because of the port explosion. And I saw that individuals in Lebanon are just numbers, unfortunately, and no one cares about the care they receive, the chronic medications they have. No one is giving the medical support they need eventually. So for me, it was the priority need of anything, and whenever a war, crisis, conflict happens, is the priority to medical assistance and to medications. Someone can eat anything, can live anywhere, but they cannot take any medication, and they cannot live without their medication. So for me, this is still in bold. And now in war, as we're facing war, it's still in bold that any individual should get the medication no matter what and where they are and where they're living and what they're eating. I care about the medication they're taking because we have a high percentage of individuals in Lebanon who are on chronic medications and cannot stop them. We're not talking about over-the-counter medications that are also needed because of these flu viruses emerging and fever between children and adults, pain and everything. But I'm talking about diabetes, asthma, heart disease, hypertension, cancer, MS, ADHD, kidney, all these chronic conditions and medical conditions that the individual cannot stop the medication even for a day. Otherwise, they're going to die. So how to support these individuals? Every single day, we operate every single day and we wake up every single day to operate and to serve our nation, to serve our people, because we took this decision since day one that we are here to serve and nothing else in all conditions and under all matter and against all odds and under all conflicts and even wars. We are here to serve. And we hope one day that our actions are not needed anymore on the ground because, we pray that the country will be at peace very soon and everyone will receive their basic medical rights that they are, they shouldn't even ask for it. They should get it. It's the basic right. It's a fundamental right. No one should beg for the right. And that's what keeps the inspiration inside our hearts to keep moving, to keep rooting for Lebanon, speaking about the mission, speaking about what's happening here, and collecting aid and donations to get the medications to the country. So as you said, my donation is not local anymore. It's registered in Europe and France. We have collection points in 65 countries. Eventually, with the cancelled flights to Lebanon now, it's getting harder to get these donations going. But we relaunched in 2 weeks 15 international drives. Eventually, the Lebanese people, foreign people, are just one hand, one heart for this mission to serve our country. So we are sending this aid with individuals traveling to Lebanon as soon as possible. It's harder, but not impossible. As I always believe and still believe up until now, it's never impossible. No matter if they close all borders, we're gonna find a way to get this aid onto Lebanon and to get this right to every individual who is in need of it. And if we still have one pill of medication, we're gonna continue fighting for this individual and for right of this individual to get the proper healthcare assistance and to avoid as much as possible to get into a healthcare crisis inside Lebanon, because eventually the diseases are increasing a lot. The conditions are getting more severe. The conditions where these individuals are living are so terrible and so horrible, and getting their conditions more terrible. So we are trying. We're gonna do our utmost best as we've done since day one to continue moving forward, and we count on every individual's support to keep on moving forward.
I'm admired of what you do and with how big wish and will you're doing this. So thank you very much. I'm saying this from one humanitarian side of me. So I'm really glad to know you, to know people like you. But I would like to ask needs of your organization and your working were there even before the war. So what is this general situation in Lebanon with the access of healthcare?
Yeah, it is a need because eventually this need started because of the economic crisis, I would say. And the economic crisis led to the increase of prices of medications inside the country, which led a certain population cannot access their medications anymore. Second, the economic crisis led to a shortage of medications inside the country. In 2021, we faced a total shortage of all types of medications because of lack of military transfers from and to Lebanon, and the pharma companies couldn't import medications because Lebanon is based mostly on importing medications and not local manufacturers. We have local, but also the raw materials are imported. So if the chain of importing was affected, then the whole production will be affected. So this is from a side. The second side, the subsidized medications are not more subsidized inside the government. So these individuals cannot get their medications on subsidized prices and terms, and accessibility. So they cannot access the medication anywhere and everywhere inside Lebanon. maybe it's found in one pharmacy or not the other. And whenever there's a security threat in Lebanon, patients and people rush to the pharmacies to stock their medications. And I say this because they know that there is no plan to secure their basic needs. So, example, if I take a medication X, I go buy 12 boxes because I am in fear that this war could last long and I cannot get it anymore. So let's say the country import 1,000 boxes of Panadol, paracetamol, which is for pain. The demand was 4,000 boxes in normal days. But now, because of the war, let's say 50 individuals bought 20 boxes. Then the supply and demand, the balance is unbalanced anymore because we're importing for a quantity aiming to support 1,000 individuals and is only supporting 200, 300 individuals. So we were left with 600 or 500 individuals not accessing their medications. So that's what we call shortage. And even unfortunately, we saw black market inside Lebanon, which is if this medication is out of stock, they get it from other countries and sell it for ×3 the price. So all this is lack of regulation, lack of plan. Again, we go to the plan, because if you had a plan, these people wouldn't be in fear of not getting the needs they want, even in times of war. Because our parents lived war and they didn't have this in mind to stock bread, to stock medications because it was accessible yet. But now we cannot access it. And the explosion, we faced it. And then after the explosion, we faced it. And up until now, we still face it. And we're gonna still face it if the government didn't do a national plan for it. So that's it.
Yes, profiteering is present in everywhere there is out there. People are unfortunately try to use the catastrophe people live in to make money, which is very yes, very bad move for the humanity, especially in times when we have to be all together to help people in need. And at the end, your foundation established free health clinic. So is it working already? Is it already done? And is really free for the people in Lebanon?
Everything in Med Donations is free. Every single thing, every aspect of our work is free of charge. They do not pay anything, even a single penny. They do not pay anything because it's a right. And every individual should get access to this right no matter what. So this is to start with. The free clinic project is established. We have the free clinic infrastructure ready. And now what we shifted, because patients cannot get inside the clinic, cannot transfer it easily, we did teams on the ground. If I want to talk now inside war, we have healthcare professional teams on the ground, from pharmacists, nurses, healthcare professionals, med students, and many more, who are inside the regions, different regions inside Lebanon. We are giving them the medications, they are assessing the case and distributing the medications accordingly. And now we are working on a project to implement teleconsultation in these regions, in these schools and shelters, so patients can see doctor and can get their vital signs and make sure that they do not need further medical assistance. And some people, the majority, flew and evacuated from their homes without holding the medical prescription and even the medications. And when we talk about this, we have a majority of elderly individuals or kids, and they do not know their medications. They do not remember their medications. They are not sure about the names of the medications, and even they do not know their medical conditions. They take 10 medications and they're not aware each medication is for what. So it's lack of awareness, medical knowledge, and everything all over the years. That's why we need healthcare professionals on field to assess the needs correctly and not mistaken in any medication, because it's very critical. When I say meds, it's life or death situation. So we cannot just have list of medications written in hand and by hand and being transferred, and we get the medications and deliver randomly. It's not as chaotic as this. We need to organize it under the basic medical requirements to be able to support the direct need and help, and not do the opposite. So this free clinic is now, I would say, mobile free clinic operating in this region, and we did it in response to the war happening now.
Marina, thank you very much for accepting my invitation. It was my honor and my pleasure having you in my program. Thank you very much for all the informations, and thank you for all the job you are doing in Lebanon, because the world really needs people like you who help other people just with a clear will and not expecting anything in return. So as I said, it was really a pleasure to talk to you, and of course, please stay safe. And I hope we will have occasion to talk again, and we will talk in a free environment. So I hope I'm gonna have you in my program when this war ends with good news and some kind of celebration.
Yeah, we all hope so.
Your
We pray
country.
for it.
Thank you very much.
It was my biggest pleasure, Christina. Thank you for taking the time to talk to me. It was my honor and pleasure, and to shed the light on what's happening in Lebanon. It's crucial to keep on talking about Lebanon and the real way and on the ground, and without being biased, Thank you for giving us the chance to be on your program and to spread the word out.
And please stay safe. There's nothing more important than that. Even that is the hardest thing to do in this situation. Thanks a lot. Тоа беше Марина Ел Khawand од либанската престолнина. Пред да се одјавам уште една информација дека во Либан престојуваат тројца македонски офицери во рамки на УНИФИЛ, мисијата на Обединети нации. Оваа мисија првпат е воспоставена во 1978 година, а последен пат мандатот ти беше продолжен пред само месец и половина, односно во август годинава. Двајца македонски офицери се наоѓаат во Шама, а еден во Нагура, тоа е јужниот дел, токму онаму каде што се водат најжестоките борби. Таму има секој ден воени активности во нивна близина, а Обединетите нации веќе изјавија дека оваа мисија останува таму да ги следи состојбите и практично да биде своевиден гарант на мирот, иако тоа во моментов не е возможно. Што се однесува до Обединети нации и нивните мисии, навистина има потреба за загриженост со оглед на досегашната пракса на Израел да ги таргетира нивните локации внатре во Израел. Се уште не го направиле тоа на територијата на Либан, но како што кажав, бидејќи таква е праксата и не можеме да спиеме мирно по тоа прашање. Израел веќе побара оваа мисија УНИФИЛ да биде повлечена, пошто Обединетите нации одбија да го направат тоа, а таква порака стигна и од Стейт Департментот дека оваа мисија треба да остане на својата позиција и дека аеродромот во Бейрут не треба да се затвори за да може луѓето да влегуваат, да излегуваат, да остане активен, меѓу другото и за да се носи хуманитарна помош во оваа држава која сега веќе е под жесток напад од страна на Израел. За жал, мирот не е на повидок на Блискиот Исток. Што се однесува до состојбата во Украина, таму може би и е на повидок со оглед на мировниот план, односно планот за победа, како што го нарекуваат во Украина на украинскиот председател Володимир Зеленски, но тој план допрва треба да се разговара со европските и американските сојузници и поддржувачи на Украина, а дури потоа да може да добие некаков друг облик или пак да се преговара по него. Ви благодарам за вниманието со кое што не следевте. За жал, уште еден тажен или страшен лабиринт од воените зони се гледаме повторно следниот четврток. Довидување од мене.